Hi, my name is Dr. Pecoraro. I'm a chiropractor in Scotch Plains, New Jersey, and in this video I wanted to speak about the sacrum. Now, this is for chiropractors only because if you're not a chiropractor, you may hurt somebody if you try this, because you need to know a lot of different things that you only learn in chiropractic school. I graduated from Columbia Institute of Chiropractic, now it's called New York Chiropractic College, in 1975. Now, with the sacrum, you can palpate the sacrum with the patient in the prone position, but sometimes you won't be able to find everything so easily this way. So one position that I found that's easy to find a lot of things is to have the patient get up on their hands and knees on the table and then bring their forearms down to the table so that they're in this position, their thighs straight up in the air, and letting their lumbar area, their stomach, hang down towards the table. So the patient is something like this. And if you look at the sacrum, generally the main positions that I found that the subluxations come are posteriority of the base, posteriority on the left side of the base or the right side of the base only, posteriority of the entire sacrum, anteriority of the left base, anteriority of the right base, posteriority of the apex on one side or posteriority of the apex on the other side. And many times the posteriority is accompanied with the anteriority on the opposite side. So if the left side of the base is anterior, many times the right side of the apex is posterior, and vice versa. Now, if the sacrum is totally posterior, I found that this is addressed best with the patient in the prone position with a straight down thrust. If the base is posterior, I've also found that this is best in the prone position with a thrust on the center of the base of the sacrum, down and towards the feet slightly. If the sacrum is subluxated with the base posterior on only one side or the other, that's usually best addressed with the patient on their side with a side roll. And if you want to pull back an anteriority of the base on one side or the other, usually the opposite apex is posterior. So what you would be doing is addressing the posteriority of the opposite apex. So let's say on this patient the base was anterior on the left. Well, that would generally make the apex posterior on the right. And so the way we address that is usually in the side roll position with the patient on their side, and the contact is on the sacral apex on the side that you're adjusting, which in this case would be on the right apex because the left base is anterior. And it's going to be a regular side roll movement where the patient is brought this way, and the thrust is in this direction so that it will pull this back. So the thrust is that way. If the base was anterior on the opposite side, usually the apex will be posterior on the left side. And you would do the same thing from the opposite side. So I wanted to bring you this information. Or one more thing, that sometimes with sacral problems, the patient gets worse when they lay down. So I've had patients that couldn't even lay down for the adjustment, they were so bad. So you might have to figure something out, other way to do this, if they can't lay on their stomach, or they might not even be, well, they usually can get on their hands and knees. But if the patient lays down for the adjustment and you find that they're a lot worse afterwards, this may be the problem. It may have been a sacral problem that you missed. So if you check it in that knee chest position or the knee and forearms down on the table position that I showed you, you might find out what needs to be done. And usually there's an audible release, and most of the time there's immediate relief to some degree. It may be complete or it may be only partial, but you usually find something. And you can palpate again to also make sure that what you've done has done what you were trying to do. So I hope this information will be helpful to you, and I hope you'll be able to use it in your practice. Thanks.